Hey, it's Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com. And anytime I see a patient with a bonded retainer, be it an upper one or a lower one, it's a red flag for me. Let me tell you some more. And if you are a dentist and you ever had a patient ask you to remove one of those, that is a red flag for you. And I've made a lot of content on extra informed consents, risks, things you should be thinking about. Sure, I'm sure you can pull out a handpiece and take one of those off. I can do that with my eyes closed. Anyone can. But do you know what can happen down the road? Do you know how to protect yourself? And do you know what you should be thinking before you even do this? Let's take you through it. So, first of all, I want to put one thing out there in terms of cases where you're doing retreatment where they had a bonded retainer. This is very common. Those retreatment cases are like low-hanging fruit, right? They're the ones that Invisalign tells us to go find and get. If you can still find them, most of them have been done. 15, 20 years ago, those were definitely awesome because there was so many of them out there. But occasionally those happen, right? First of all, if you got relapse and there's a bonded retainer, that's not normal because that means either the bonded retainer wasn't put on right, or it broke or failed, or the patient has some type of myo issue or other issue that caused the bonded retainer to fail. And that's what I want you to be thinking about. Ask the patient, do you know why it was put on? They may not know, okay? Sometimes there's some dentists that just put them on everyone, okay? Those are the ones, yeah, it's probably okay to take those off. If they say that, obviously you need to have some basic myofunctional training. I would not even touch dealing with one of these unless you had basic myofunctional training, because if you find one that did have a myo issue, you don't have the training, you didn't know, you go and take it off. Now things start to relapse, and now guess who's legally responsible? It would be you. There's no way around it. You're going to be responsible for this because you didn't have the right paperwork in place. Okay. So you get that idea. Let's say you are doing an Invisalign case, you had to take it off, to do a retreatment, you realize there was no myo issues, that's great. The main thing, the other trap that you can fall into is that you allow the clear aligner company to virtually remove that retainer. They all say, oh, it's okay, it's fine. No, it's not. That's not accurate. Let's explain why that's not accurate, okay? So first of all, just this might not make a super ton of sense to you, but it makes sense to me because I'm an orthodontist. So I'm going to try my best to explain it and like I was explaining it to a patient, but they're probably not going to understand. Okay, so we've got this retainer. It was put on. There's probably a wire. They may or may not be mesh pads. Then there's some adhesive that holds the pads or the wire to the tooth, right? So there's a couple layers to this. You got tooth, adhesive, possibly a pad, and then a wire, right? So you have 3 or 4 layers moving from lip side to tongue side, okay? So let's say that we ask the software AI to virtually remove it. It's trying to identify with its artificial intelligence what is glue, what is tooth, and what is metal. And it's going to remove only the glue and the metal, leaving the tooth. Well, it doesn't know exactly where one ends and one begins. It's not able to do that. It's not that smart, right? So it's just guessing. If it over removes structure, you're going to have if I'm doing this right, you're going to have a gap in between the tooth and the actual aligner. So that means the whole backside where it overestimated is not actually touching the tooth. It's going to have a gap, almost like an air bubble, like a tracking issue, except for it's just a software tracking issue. It's not the patient went off track. So therefore that tooth is not going to move properly until you actually do the refinement. So sure, you can have it virtually removed. If it seats down 100%, it's just not going to accurately move the teeth. You can plan to do a refinement in a month. I mean, sure, you can do that. I don't care. That seems like a super waste of money, time, patient time, your time, staff time, resources in the office, shipping, and for inline technology, that seems like a waste. So, I mean, I feel like that company should be incentivized not to have you do that. So, but I'm just throwing that out there as an option. It doesn't cost you well, it does cost you more because your time is money. Your chair time is money. Okay. So what if it did the other way? Whether if it underestimated, well, then the sucker's just not going to fit down and it's going to be high. So, or it's just going to move things in a really bad way and you're not going to know until it happens. And then it's just going to make the case take longer. So to me, there's no way it's going to be accurate. So since it's not going to be accurate, it's going to be inaccurate, which is going to make your case take longer. That's just dumb. So that's why you don't virtually remove the retainer. Or if you do, you pair it with a new scan later. Okay, so let's go over again the red flags. Why I feel like anytime I see a bonded retainer, it's a red flag and things that are going on in my head. So, okay. So we talked about the virtual removal. Let's talk about the red flags. Go back to that. So first of all, for an upper one, it's a red flag to me. If they have when put on, it's almost always either a tongue thrust or a frenum pull that wasn't handled properly. So, I mean, no one should really be. I sometimes put them on if I'm trying to settle a bite and then we remove them. That's fine. There's nothing wrong with that. But then they don't stay on. That's not the only retainer. And sometimes people do that and then they just make an Essex that goes on top. And then this is just an insurance policy. I don't have a huge issue with that either. But yeah, you can have a high freedom pull that causes the tooth to open up easily. If it's not managed, you have to have a bonded retainer. Hopefully you don't have anterior contacts. That is like the worst thing for teeth. When you have the anterior contacts and they're stuck in that bonded retainer, that almost always causes root resorption. And that is a reason to get sued. Let's talk about myofunctional issues like tongue thrust, of course. Yeah, you can, that's what they tell you to do in those cases. Oh, just throw a bonded retainer in. But again, now you have a counterforce coming from the back and the teeth aren't even allowed to move. They're pushing, but they're splinted in. Well, that's going to cause root resorption. So over time. And then if they have an undiagnosed broken retainer, well, that's not great either. So those obviously need to come off. And then in terms of the lower, well, you know, lower's the same thing. I mean, obviously if the teeth are completely straight, there's no anterior contacts, I don't mind putting one on, but then we've got the whole perio and the cleaning. It's almost impossible to keep those guys really clean. I mean, if it's hard for me to keep my teeth really clean, just being like a really good dentist and having great home care and all the tools, I have everything that's out there, probably stuff that you guys don't even, well, that lay people don't even have. It's a struggle for me to clean my teeth. It would be a nightmare to clean it with a bonded retainer on. I would never want one. Yucky. But I mean, some people really like them. So just keep in mind, I would highly recommend having some type of warranty or paperwork whenever you put one on. I do have a bonded retainer warranty that I can give out to anyone who has done a session with me, if you've taken my course, or if you've been a client of any shape or form. I do give you guys 3 paperworks of your choice per month that you're with me. So reach out to me if you are one of those. It has to be why you're currently with me though, not if it was like years ago. But if you're placing one, consider making your own custom disclaimer. Certainly if you think there's any chance of a myofunctional issue, I would have that in there. I would have something about potential of root resorption. Now, who owns the aftercare responsibility of the phase? And this is what this comes down to. This is the hardest part. You place one of these suckers on, and I always say you're married to this patient for life, which is not a big deal if you're a general dentist, right? Because the patient's coming in every 6 months anyways. So I think that just needs to be built into the contract. The retainer contract. Most orthodontists offer maintenance on the retainers and checks for up to 1 year afterwards. After that, it's up to the discretion, but usually there's a cost, but there shouldn't be retainer anything you need to do. If things are relapsing, either you're not wearing it or there's a myofunctional or habit or airway issue. It's one or the other. So it's real simple. If we get all the myofunctional, habit, and airway issues out of the way to begin with, and we don't take those cases or let these patients talk us into taking the cases, which happens very often, then we won't have issues at relapse as long as retainers are being worn. That's a fact, Jack. So definitely consider having some type of policy agreement, making a warranty of some sort. If you're placing one of these, you need to have a clear policy as when they need to come in to get checked, who's paying for the checks. No, they shouldn't have lifetime maintenance. I've given you guys the whole analogy of, unless you're building that into their hygiene checks, which I think is a brilliant idea. Matter of fact, I think you should build it. As long as they're a hygiene patient, they get lifetime maintenance. I didn't say free retainers, but they get maintenance and checks for life. Putting that in is not a bad idea. It brings people into the office. They're not getting anything for free. They're just getting your knowledge for free. They're getting the checks. So do that. And that way, if they miss their 6-month check and they don't come in, it's on them if something fails. I think you should totally build that into it. Of course, that doesn't benefit the orthodontist because they don't have a way to monetize aftercare. I mean, they do. There's some third-party companies that they're realizing this now that y'all are doing this, and now they're creating their own third-party companies like, I don't know, Retainer Forever Align Club, Retainer Aftercare Club, Retainers for Life Club. There's so many out there, I can't even keep them. Retainer Direct. Yeah, they're doing their own thing as well, right? And then they have their own warranties and stuff like that. So anyways, that's pretty much it, but just things for you to think about before you take one of these off or put one of these on.